Question 1. A practical nurse, PN, is caring for a client with type 2 diabetes mellitus who has a blood glucose reading of 3.2 moles/L. The client is conscious but disoriented. What is the PN's most appropriate initial action? A. Administer 15 g of oral carbohydrates, e.g., juice or glucose tablets. B. Administer regular insulin subcutaneously as per sliding scale. C. Notify the physician immediately and wait for further orders. D. Document the finding and recheck blood glucose in 30 minutes. Answer: A. Administer 15 g of oral carbohydrates, e.g., juice or glucose tablets. The client is experiencing hypoglycemia, indicated by the low blood glucose and disorientation. In a conscious client with hypoglycemia, the priority is to administer rapid-acting oral carbohydrates to quickly raise blood glucose levels. Administering insulin would worsen the hypoglycemia, and waiting for a physician's order or merely documenting would delay critical treatment, potentially leading to more severe complications. The PN must act promptly to ensure client safety and stabilize their blood glucose levels, then continue to monitor and reassess. Question 2. A PN is preparing to administer medications through a nasogastric and tube. Which of the following actions is essential to prevent complications and ensure medication effectiveness? A. Crush all medications to a fine powder before mixing with water. B. Mix all prescribed medications together in a single syringe. C. Flush the NG tube with 15 to 30 milliliters of water before and after each medication. D. Administer medications rapidly to ensure quick absorption. Answer: C. Flush the NG tube with 15 to 30 milliliters of water before and after each medication. Flushing the NG tube with water before medication administration ensures tube patency and prevents medication interactions with residual feeding, while flushing after administration clears the medication from the tube and helps prevent tube occlusion. Crushing all medications is not always appropriate, as some medications are extended-release or enteric-coated and should not be crushed. Mixing all medications together can lead to drug interactions or precipitation, and rapid administration can cause discomfort or lead to aspiration. Adhering to proper flushing techniques is crucial for safe and effective medication delivery via NG tube. Question 3. A client in a long-term care facility frequently attempts to remove their intravenous line. The PN is considering applying a restraint. According to CPNRE guidelines, what is the most important consideration before applying a physical restraint? A. Obtain a physician's order for the restraint immediately after application. B. Inform the client's family about the restraint application after it has been applied. C. Exhaust all less restrictive alternatives first and document these interventions. D. Apply the restraint to prevent self-harm and reassess the need in 24 hours. Answer: C. Exhaust all less restrictive alternatives first and document these interventions. Before applying any physical restraint, the PN must first exhaust all less restrictive alternatives, such as reorientation, diversion, or increased supervision, and document these attempts. Restraints are considered a last resort to ensure client safety and dignity, and their use is highly regulated. A physician's order is typically required before or immediately after application in emergencies, and the family should be informed, but exploring alternatives is the foundational ethical and legal step. This approach prioritizes client autonomy and minimizes potential harm associated with restraint use. Question 4. A PN is caring for a client experiencing acute dyspnea and wheezing. The client has a history of asthma. What is the PN's priority assessment? A. Assess the client's skin turgor and hydration status. B. Auscultate lung sounds and assess respiratory rate and effort. C. Check the client's peripheral pulses and capillary refill. D. Review the client's most recent complete blood count, CPC. Answer: B. Auscultate lung sounds and assess respiratory rate and effort. For a client experiencing acute dyspnea and wheezing, the priority assessment focuses on the respiratory system to determine the severity of respiratory distress. Auscultating lung sounds will confirm the presence and quality of wheezing and air movement, while assessing respiratory rate and effort provides immediate insight into the client's oxygenation and ventilation status. While other assessments are important, they are not the immediate priority in an acute respiratory emergency. This direct assessment guides immediate interventions and ensures client safety. Question 5. A PN is administering a new medication to a client. What is the most important action the PN should take to prevent a medication error? A. Ask the client if they have taken this medication before. B. Verify the 5 rights of medication administration. C. Compare the medication label to the medication administration record, MAR, once. D. Administer the medication immediately to maintain schedule. Answer B. Verify the 5 rights of medication administration. Verifying the 5 rights, right client, right medication, right dose, right route, right time of medication administration is the most crucial step to prevent errors. This systematic approach ensures comprehensive checking before administration, significantly reducing the risk of mistakes. While asking the client about previous use and comparing the label to the MAR are important, the 5 rights encompass these and more, providing a robust safety checklist. Adhering to this principle is a fundamental responsibility of the PN to ensure client safety and medication efficacy. Question 6. A client is scheduled for discharge from the hospital after a stroke. The PN is providing discharge teaching. Which topic is most essential for the PN to include to ensure continuity of care and client safety at home? A. Information about stroke support groups in the community. B. Detailed instructions on medication administration and potential side effects. C. The client's favorite healthy recipes for meal planning. D. A list of hospital volunteer opportunities. Answer B. Detailed instructions on medication administration and potential side effects. For a client discharged after a stroke, detailed instructions on medication administration and potential side effects are paramount to ensure client safety and prevent readmission. Post-stroke clients often have multiple medications, and proper adherence is vital for recovery and prevention of further complications. While support groups and healthy recipes are beneficial, medication education directly impacts their physical well-being and reduces the risk of adverse events. This comprehensive medication teaching empowers the client and caregivers to manage their health effectively at home. Question 7. A PN observes a colleague consistently bypassing hand hygiene protocols between client contacts. What is the PN's most appropriate initial action? A. Report the colleague directly to the College of Nurses. B. Confront the colleague publicly to ensure immediate change. C. Privately remind the colleague about the importance of hand hygiene protocols. D. Ignore the behavior, assuming the colleague knows best. Answer C. Privately remind the colleague about the importance of hand hygiene protocols. The most appropriate initial action is to privately remind the colleague about the importance of hand hygiene protocols. This allows for a direct, non-confrontational approach to address a patient safety concern. If the behavior continues after the private reminder, then escalating the issue through appropriate channels, such as a charge nurse or supervisor, would be necessary. Reporting directly to the college or public confrontation are typically not initial steps for resolving workplace practice issues and can disrupt team dynamics, whereas ignoring the issue compromises client safety. Question 8. A client presents to the emergency department with severe abdominal pain, nausea, and vomiting. The PN assesses the client's vital signs and finds a fever of 39, 5 degree C, 103, 1 degree F, heart rate 110 BPM, and blood pressure 90/50 millimeter of mercury. What is the PN's most immediate concern? A. Fluid and electrolyte imbalance. B. Risk for acute appendicitis. C. Potential for septic shock. D. Nutritional deficiency. Answer C. Potential for septic shock. The client's vital signs, fever, tachycardia, and hypotension, are classic indicators of potential septic shock, a life-threatening condition. While fluid and electrolyte imbalance and appendicitis are plausible concerns, The combination of fever and hypotension strongly suggests a systemic inflammatory response syndrome, SIRS, that could progress rapidly to shock. Recognizing and responding to these signs promptly is critical for initiating early interventions to improve client outcomes. The PN's immediate concern is to address the instability and potential for organ dysfunction. Question 9. When assessing a client's pain, a PN uses a pain scale, e.g., 0 to 10. Which aspect of the pain assessment is most important to document to ensure comprehensive pain management? A. The client's facial expression during pain. B. The numeric pain rating provided by the client. C. The specific location, quality, intensity, onset, duration, and aggravating/alleviating factors of the pain. D. The client's willingness to take pain medication. Answer C. The specific location, quality, intensity, onset, duration, and aggravating/alleviating factors of the pain. A comprehensive pain assessment includes not only the intensity, numeric rating, but also the specific location, quality, onset, duration, and any aggravating or alleviating factors. This detailed information allows the healthcare team to understand the nature of the pain, differentiate between types of pain, and develop an individualized and effective pain management plan. Relying solely on a numeric rating or facial expressions provides an incomplete picture, and client willingness to take medication is an outcome of the pain, not an assessment of it. Thorough documentation ensures continuity of care and appropriate interventions. Question 10. A PN is caring for an older adult client with a new prescription for an opioid analgesic. What is the most important teaching point to emphasize with this client and their family? A. Opioid analgesics are highly effective for chronic pain and should be taken indefinitely. B. The client should increase the dose if pain is not relieved after 30 minutes. C. To avoid constipation, increase fluid intake and dietary fiber, and use stool softeners as prescribed. D. Opioid addiction is common, so the medication should only be used as a last resort. Answer C. To avoid constipation, increase fluid intake and dietary fiber, and use stool softeners as prescribed. Constipation is a very common and significant side effect of opioid analgesics, particularly in older adults who may already have slower bowel motility. Emphasizing preventative measures like increased fluid intake, dietary fiber, and the use of prescribed stool softeners is crucial for client comfort and to prevent complications such as fecal impaction. While effectiveness and addiction risk are important, managing common side effects proactively enhances adherence and quality of life. The PN's role includes proactive education on managing expected medication side effects. Question 11. A client is recovering from a total hip arthroplasty. The PN is reinforcing teaching regarding hip precautions. Which instruction is most critical for the client to follow? A. Avoid crossing the legs or ankles. B. Keep the affected leg externally rotated. C. Perform passive range of motion exercises independently. D. Bend at the waist to pick up objects from the floor. Answer A. Avoid crossing the legs or ankles. Avoiding crossing the legs or ankles is a critical hip precaution after total hip arthroplasty, as it helps prevent dislocation of the new hip joint. This action can cause adduction and internal rotation, placing stress on the surgical site. External rotation, independent passive range of motion, and bending at the waist all place the hip in positions that increase the risk of dislocation and should be avoided. The PN's teaching must prioritize these precautions to ensure the integrity of the surgical repair and promote safe recovery. Question 12. A PN is reviewing a client's chart and notes a "do not resuscitate" NR order. What does this order mean regarding the client's care? A. The client will receive no medical care if their heart stops or they stop breathing. B. The client will not receive chest compressions, artificial ventilation, or defibrillation in case of cardiac or respiratory arrest. C. The client is refusing all medical treatments, including comfort care. D. The client wishes to be discharged home to die, regardless of their medical stability. Answer B. The client will not receive chest compressions, artificial ventilation, or defibrillation in case of cardiac or respiratory arrest. Do not resuscitate. DNR order specifically means that if the client experiences cardiac or respiratory arrest, interventions such as chest compressions, artificial ventilation, and defibrillation will not be performed. It does not mean the client receives no medical care. Instead, all other appropriate treatments, including comfort care and symptom management, should continue as indicated. The DNR order respects the client's wishes regarding end-of-life care, ensuring their autonomy in making critical health decisions. The PN's role is to ensure these wishes are honored and communicated within the healthcare team. Question 13. A client with chronic kidney disease is advised to follow a low-sodium diet. What is the most important teaching point for the PN to provide regarding dietary choices? A. Avoid all dairy products. B. Read food labels carefully to identify sodium content. C. Increase intake of processed meats for protein. D. Limit fluid intake to prevent fluid overload. Answer B. Read food labels carefully to identify sodium content. For a client on a low-sodium diet, reading food labels carefully to identify sodium content is the most important teaching point. Hidden sodium is prevalent in many processed and packaged foods, making label reading essential for effective dietary management. While fluid intake may be restricted in some cases, and processed meats are high in sodium, avoiding all dairy products is not universally required for a low-sodium diet and could lead to nutritional deficiencies. Empowering the client with label reading skills provides them with the tools to make informed dietary choices and manage their condition effectively. Question 14. A PN is caring for a client with a new colostomy. The client expresses anxiety about managing the stoma and changing the appliance. What is the most appropriate nursing intervention? A. Tell the client that it will become easier with practice. B. Provide detailed written instructions and a video demonstration. C. Arrange for a visit from an enterostomal therapist. D. Encourage the client to avoid looking at the stoma until they are ready. Answer C. Arrange for a visit from an enterostomal therapist. Arranging for a visit from an enterostomal therapist, ET nurse, is the most appropriate intervention. ET nurses are specialized in ostomy care and can provide expert, individualized teaching, emotional support, and practical demonstrations tailored to the client's needs. While written instructions and encouragement are helpful, specialized support from an ET nurse ensures comprehensive education and skill development, building the client's confidence in managing their new colostomy. This interprofessional collaboration optimizes client outcomes and promotes self-care. Question 15. A PN is assessing a 4-year-old child admitted with dehydration. Which finding would be the most concerning to the PN? A. The child is irritable and restless. B. The child has sunken fontanelles. C. The child's urine output is decreased. D. The child's mucous membranes are dry. Answer B. The child has sunken fontanelles. While all options indicate dehydration, sunken fontanelles are a critical sign of severe dehydration in infants and young children, indicating significant fluid volume deficit. Irritability, decreased urine output, and dry mucous membranes are also signs of dehydration but may be present in moderate cases. The presence of sunken fontanelles requires immediate attention and aggressive fluid replacement to prevent further complications. The PN's ability to recognize this specific sign is crucial for prioritizing care in pediatric dehydration. Question 16. The PN is assisting with a sterile dressing change for a wound. During the procedure, the PN accidentally touches the sterile field with an unloved hand. What is the most appropriate action? A. Continue with the dressing change, as the touch was brief. B. Cover the sterile field with a new sterile drape and continue. C. Notify the physician and request a new order for a dressing change. D. Discard the contaminated items, re-establish a new sterile field, and restart the procedure. Answer D. Discard the contaminated items, re-establish a new sterile field, and restart the procedure. If a sterile field is contaminated, It is no longer sterile, and all contaminated items must be discarded. The PN must then re-establish a completely new sterile field and restart the procedure from the beginning to prevent infection. Covering the field or continuing the procedure would introduce microorganisms into the wound, increasing the risk of infection. Notifying the physician is unnecessary for this procedural error, as the PN can independently correct the contamination by setting up a new sterile field. Strict adherence to a septic technique is paramount for client safety during sterile procedures. Question 17. A client with a history of heart failure reports sudden shortness of breath, orthopnea, and develops crackles in the lung bases. Which nursing intervention should the PN prioritize? A. Administer prescribed oxygen therapy and position the client in high Fowlers. B. Encourage the client to ambulate to promote lung expansion. C. Administer an as-needed PRN bronchodilator. D. Obtain a sputum culture immediately. Answer: A. Administer prescribed oxygen therapy and position the client in high Fowlers. The client's symptoms, sudden shortness of breath, orthopnea, crackles, are indicative of acute exacerbation of heart failure, likely due to fluid overload in the lungs, pulmonary edema. The priority intervention is to improve oxygenation and reduce venous return. Administering prescribed oxygen addresses hypoxemia, and positioning the client in high Fowlers helps reduce venous return to the heart and facilitates lung expansion, thereby easing breathing. Ambulation would worsen their condition. Bronchodilators are not indicated for pulmonary edema, and a sputum culture is not an immediate priority. This immediate response aims to stabilize the client's respiratory status. Question 18. A PN is caring for a client who is NPO, nothing by mouth, and scheduled for surgery. The client reports feeling thirsty. What is the most appropriate response by the PN? A. Offer a small glass of water, as a little bit won't hurt. B. Provide ice chips to help with dry mouth. C. Explain the importance of being NPO for surgery and offer oral care. D. Notify the surgeon immediately that the client is thirsty. Answer: C. Explain the importance of being NPO for surgery and offer oral care. For a client who is NPO for surgery, it is crucial to explain the rationale behind the restriction to ensure understanding and adherence, as ingesting anything orally can increase the risk of aspiration during anesthesia. Offering oral care, such as a mouth rinse or moist swabs, helps alleviate thirst and dry mouth without violating the NPO status. Offering water or ice chips would compromise client safety during surgery. Notifying the surgeon is not necessary unless the client has ingested something, as thirst is an expected discomfort. The PN's role is to educate and provide comfort within the NPO guidelines. Question 19. A client refuses to take their prescribed oral medication, stating they feel better and don't need it. What is the PN's most appropriate initial action? A. Document the refusal and discard the medication. B. Force the client to take the medication, explaining it's necessary. C. Educate the client on the purpose of the medication and the potential consequences of refusal. D. Notify the physician immediately without further client interaction. Answer: C. Educate the client on the purpose of the medication and the potential consequences of refusal. When a client refuses medication, the PN's initial action should be to educate them about the medication's purpose, its benefits, and the potential consequences of not taking it. This empowers the client to make an informed decision and respects their autonomy. If the client still refuses after education, then the refusal should be documented and the physician notified. Forcing medication is unethical and illegal, and discarding without proper client interaction bypasses an important opportunity for education. The PN advocates for the client's informed choice while ensuring safety. Question 20. A PN is teaching a client with peripheral neuropathy about foot care. Which statement by the client indicates a need for further teaching? A. I should inspect my feet daily for any cuts or sores. B. I will wear comfortable, well-fitting shoes every day. C. I can walk barefoot around the house to let my feet breathe. D. I will avoid using harsh chemicals or extremely hot water on my feet. Answer C. I can walk barefoot around the house to let my feet breathe. Walking barefoot around the house, especially for a client with peripheral neuropathy, significantly increases the risk of injury, cuts, or infections due to decreased sensation. Clients with neuropathy may not feel minor injuries, which can lead to serious complications. Daily inspection, proper footwear, and avoiding harsh chemicals or hot water are all appropriate foot care practices. The PN must emphasize the importance of protecting the feet at all times to prevent unnoticed trauma and subsequent complications in neuropathic clients. Question 21. A client is scheduled for a blood transfusion. Before initiating the transfusion, which action is the most critical for the PN to perform? A. Warm the blood product to body temperature. B. Ensure a signed consent form for the transfusion is in the chart. C. Administer a prophylactic antihistamine. D. Obtain a complete set of vital signs. Answer B. Ensure a signed consent form for the transfusion is in the chart. Ensuring that a signed consent form for the blood transfusion is in the chart is the most critical action. Blood transfusions carry risks, and informed consent is a legal and ethical requirement, confirming the client understands the procedure and agrees to it. While obtaining vital signs is essential before starting, and warming blood or giving prophylactic antihistamines may be ordered, the absence of informed consent takes precedence. The PN must confirm this prerequisite before proceeding with any preparation for the transfusion to uphold client rights and legal compliance. Question 22. A client with an indwelling urinary catheter complains of bladder discomfort. The PN notes that the client has not voided in the past 4 hours. What is the most appropriate initial nursing action? A. Administer a PRN diuretic. B. Increase the client's fluid intake. C. Check the catheter tubing for kinks or obstructions. D. Remove the indwelling catheter immediately. Answer C. Check the catheter tubing for kinks or obstructions. Bladder discomfort and lack of urine output in a client with an indwelling catheter strongly suggest a kink or obstruction in the tubing, preventing urine drainage. The most appropriate initial action is to assess and correct any mechanical issues with the catheter system. Administering a diuretic or increasing fluid intake would worsen discomfort if the urine cannot drain, and immediately removing the catheter without assessing for obstruction could lead to acute urinary retention. The PN should troubleshoot the system, first to restore proper drainage and relieve discomfort. Question 23. A PN is caring for a client with a history of falls. Which intervention is most effective in preventing future falls? A. Keep the client's bed in the highest position for easier nursing access. B. Encourage the client to ambulate independently without assistance. C. Ensure the client's call bell is within reach and teach them how to use it. D. Administer a sedative to keep the client calm and still. Answer C. Ensure the client's call bell is within reach and teach them how to use it. Ensuring the client's call bell is within reach and teaching them how to use it effectively empowers the client to request assistance when needed, which is critical for fall prevention. Other effective strategies include keeping the bed in the lowest position with side rails up as appropriate, providing adequate lighting, and assisting with ambulation if the client is a fall risk. Keeping the bed high, encouraging independent ambulation for high-risk clients, or sedating them would increase fall risk or infringe on their autonomy. Promoting accessible communication is a key safety measure. Question 24. A client is experiencing an allergic reaction to a medication, manifesting as rash, itching, and mild shortness of breath. After stopping the medication, what is the PN's next priority action? A. Administer prescribed epinephrine immediately. B. Notify the physician of the client's symptoms. C. Assess the client's airway, breathing, and circulation, ABCs. D. Document the allergic reaction in the client's chart. Answer C. Assess the client's airway, breathing, and circulation, ABCs. After stopping the offending medication, the PN's next priority is to assess the client's ABCs, airway, breathing, and circulation. Although the current shortness of breath is mild, an allergic reaction can rapidly escalate, potentially leading to airway compromise or anaphylaxis. A rapid assessment of ABCs determines the severity and guides subsequent interventions, such as administering oxygen or preparing emergency medications. Notifying the physician and documentation are important, but follow the immediate assessment and stabilization of the client's vital functions. This rapid assessment is crucial for preventing a life-threatening event. Question 25. A PN is providing education to a group of new parents on infant safety. Which statement should the PN emphasize as most critical for preventing sudden infant death syndrome? SIDS? A. Always place your baby on their back to sleep, for every sleep. B. Ensure your baby wears a hat to bed to keep them warm. C. Use soft bedding and bumper pads in the crib for comfort. D. Allow your baby to sleep in the same bed as you to facilitate bonding. Answer: A. Always place your baby on their back to sleep, for every sleep. The most critical advice for preventing SIDS is to always place infants on their back to sleep, for every sleep, until they are 1 year old. This recommendation significantly reduces the risk of SIDS. Other practices, such as ensuring a safe sleep environment free of soft bedding, bumper pads, or loose blankets, and avoiding co-sleeping, are also vital. Hats can lead to overheating, and soft bedding or co-sleeping increase suffocation risk. The Back to Sleep campaign is a cornerstone of infant safety education. Question 26. A client with a history of C. difficile infection is being discharged. What essential hand hygiene education should the PN provide to the client and family? A. Alcohol-based hand sanitizer is sufficient for routine hand hygiene. B. Wash hands thoroughly with soap and water after using the toilet and before eating. C. Wearing gloves at home is necessary for all interactions with the client. D. Hand hygiene is only required if there is visible soiling. Answer: B. Wash hands thoroughly with soap and water after using the toilet and before eating. For clients with C. difficile, thorough hand washing with soap and water is essential. Alcohol-based hand sanitizers are not effective against C. difficile spores. Emphasizing hand washing after using the toilet and before eating is crucial to prevent the spread of the infection within the home environment. While gloves might be used for specific tasks, routine hand hygiene with soap and water is the primary defense. Educating on proper hand washing specifically for C. difficile is key to infection control. Question 27. A PN is assessing a client's wound that has purulent drainage, redness, and warmth around the site. The client also has a fever. What is the most likely complication the PN should suspect? A. A sterile inflammatory response. B. Normal wound healing process. C. Wound dehiscence. D. Wound infection. Answer: D. Wound infection. The presence of purulent drainage, redness, warmth, and fever are classic signs and symptoms of a wound infection. A sterile inflammatory response would not typically involve purulent drainage or fever. Normal wound healing progresses through inflammatory, proliferative, and remodeling phases, but purulent drainage is not a normal finding. Wound dehiscence refers to the separation of wound edges. Recognizing these signs is crucial for the PN to alert the healthcare team and initiate appropriate interventions, such as cultures and antibiotics, to prevent further complications. Question 28. A PN is preparing to administer an intramuscular injection to an adult client. Which muscle site is generally considered the safest for most adult IM injections due to minimal risk of nerve or vessel damage? A. Deltoid muscle. B. Ventrogluteal muscle. C. Dorsogluteal muscle. D. Vastus lateralis muscle. Answer: B. Ventrogluteal muscle. The ventrogluteal muscle is generally considered the safest and preferred site for most adult IM injections because it is free of major nerves and blood vessels, reducing the risk of injury. The deltoid is suitable for smaller volumes, and the vastus lateralis is often preferred for infants and children, but the ventrogluteal offers a larger, safer site for adults. The dorsogluteal site is generally avoided due to the proximity of the sciatic nerve. Proper site selection is vital for safe and effective medication administration. Question 29. A client with dementia becomes agitated and starts yelling. What is the most appropriate initial response by the PN? A. Restrain the client to prevent harm to self or others. B. Confront the client directly and tell them to stop yelling. C. Speak in a calm, soothing voice, offer reassurance, and try to identify the trigger. D. Leave the client alone in the room until they calm down. Answer C. Speak in a calm, soothing voice, offer reassurance, and try to identify the trigger. When a client with dementia becomes agitated, the most appropriate initial response is to approach calmly, speak in a soothing voice, offer reassurance, and attempt to identify the underlying trigger for the agitation. Agitation in dementia often stems from unmet needs, pain, fear, or confusion, rather than intentional misbehavior. Restraining or confronting the client can escalate agitation, and leaving them alone might increase fear or risk of harm. The PN's empathetic and investigative approach helps de-escalate the situation and address the client's needs. Question 30. A PN is assessing a client who just received a new cast for a fractured tibia. Which finding would indicate a potential complication requiring immediate attention? A. Mild swelling around the cast edges. B. The client reports a tingling sensation in their toes. C. The client states the cast feels a bit heavy. D. The cast feels warm to the touch. Answer B. The client reports a tingling sensation in their toes. A tingling sensation in the toes, paresthesia, after cast application is a critical sign of potential neurovascular compromise, specifically indicative of nerve compression or impaired circulation, which could lead to compartment syndrome. This requires immediate attention to prevent permanent damage. While mild swelling and the cast feeling heavy can be normal, and a warm cast can indicate plaster setting, paresthesia signifies a serious problem. The PN must promptly assess circulation, movement, and sensation, CMS, and notify the physician to ensure timely intervention. Question 31. A PN is reinforcing education for a client with type 1 diabetes mellitus about insulin injection sites. Which statement indicates that the client understands the teaching? A. I should inject my insulin into the same spot every time for consistency. B. I can inject my insulin into any fatty area of my body, rotating sites within that area. C. Injecting insulin into muscles makes it absorb faster, so I'll do that before meals. D. I should always use the abdomen as the injection site because it's the easiest. Answer B. I can inject my insulin into any fatty area of my body, rotating sites within that area. Proper insulin administration involves rotating injection sites to prevent lipohypertrophy, fat deposits, or lipoatrophy, tissue breakdown, which can impair insulin absorption. While rotating sites, it's generally recommended to rotate within one area, the abdomen, before moving to a new general area, thigh, to maintain consistent absorption rates. Injecting into muscles is not recommended as it can cause faster, less predictable absorption, and using only one spot or the abdomen exclusively is incorrect. The PN's teaching ensures optimal insulin efficacy and reduces complications. Question 32. A PN is preparing to document care for a client. Which statement accurately reflects appropriate nursing documentation practices? A. Document care at the end of the shift to save time. B. Only document abnormal findings and significant events. C. Document objective, factual observations and interventions as they occur. D. Use personal abbreviations and slang to shorten entries. Answer C. Document objective, factual observations and interventions as they occur. Accurate nursing documentation requires objective, factual observations and interventions to be recorded as they occur or as soon as possible after completion. This ensures the record is timely, reliable, and reflects the actual sequence of events, supporting legal and ethical standards of care. Documenting at the end of the shift increases the risk of omissions or inaccuracies. Omitting normal findings can provide an incomplete picture, and using personal abbreviations or slang is unprofessional and can lead to misinterpretation. Comprehensive and timely documentation is a cornerstone of safe nursing practice. Question 33. A client is experiencing postoperative nausea and vomiting. The PN administers the prescribed antiemetic. What is the most important intervention to perform after administering the medication? A. Offer the client a full meal immediately. B. Encourage deep breathing and coughing exercises. C. Assess the client's effectiveness of the medication and comfort level. D. Ambulate the client to promote peristalsis. Answer C. Assess the client's effectiveness of the medication and comfort level. After administering any medication, especially for symptom management, the most important intervention is to assess the client's response to the medication and their comfort level. This allows the PN to evaluate the effectiveness of the intervention and determine if further actions are needed. Offering a full meal might exacerbate nausea. Deep breathing/coughing may be difficult during nausea, and ambulating too soon could lead to falls. The PN's critical thinking involves not only administering medications, but also evaluating their impact on the client's condition. This ensures timely and effective symptom management. Question 34. A PN is caring for a client with a new peripherally inserted central catheter, PICC. Which observation requires immediate intervention by the PN? A. The client's arm is slightly swollen above the insertion site. B. The client reports mild discomfort at the insertion site. C. The external length of the catheter has changed since the last measurement. D. A small amount of clear drainage is present at the dressing site. Answer C. The external length of the catheter has changed since the last measurement. A change in the external length of a PICC line is a critical finding that could indicate migration of the catheter tip, which can lead to complications such as dysrhythmias, vessel erosion, or ineffective therapy. This requires immediate assessment and possible repositioning by the physician. Mild swelling, discomfort, or small amounts of clear drainage, while needing monitoring, are not as immediately concerning as a change in external length, which directly impacts the catheter's function and safety. The PN must recognize this as a priority to prevent serious adverse events. Question 35. A PN is providing education to a client prescribed a new diuretic. Which instruction is most important for the PN to include? A. Take the medication at bedtime to ensure maximum effect. B. Avoid all fluid intake while on this medication. C. Report any sudden weight gain or swelling to the physician. D. Increase intake of potassium-rich foods, such as bananas and oranges. Answer C. Report any sudden weight gain or swelling to the physician. The most important instruction for a client on a diuretic is to report any sudden weight gain or swelling, as these can be signs of fluid retention, indicating the medication may not be effective or the underlying condition is worsening. Diuretics are usually taken in the morning to prevent nocturia, and fluid restriction is not universal, often depending on the type of diuretic and client condition. Potassium intake depends on the type of diuretic, e.g., potassium-sparing versus loop diuretici. Monitoring for effectiveness and adverse signs is paramount for client safety and optimal treatment outcomes. Question 36. A client is experiencing signs of an acute stroke, facial drooping, arm weakness, speech difficulty. What is the PN's immediate priority? A. Administer aspirin to prevent further clotting. B. Call for a code stroke or emergency medical assistance. C. Document the exact time of symptom onset. D. Provide comfort measures and reassure the client. Answer B. Call for a code stroke or emergency medical assistance. For a client experiencing signs of an acute stroke, the immediate priority is to call for a code stroke or emergency medical assistance. Timely activation of the stroke protocol is critical because rapid diagnosis and intervention, such as thrombolytic therapy, within a narrow time window can significantly improve client outcomes and minimize neurological damage. While documenting symptom onset is crucial and comfort measures are important, These actions are secondary to initiating the rapid response system. The PN's swift action directly impacts the client's prognosis. Question 37. A PN is caring for a client with dysphagia. Which intervention is most important to prevent aspiration during mealtimes? A. Encourage the client to drink thin liquids to clear the airway. B. Elevate the head of the bed to at least 45 to 90 degrees during meals. C. Provide a straw for easier fluid intake. D. Rush the feeding process to ensure the client finishes their meal. Answer B. Elevate the head of the bed to at least 45 to 90 degrees during meals. Elevating the head of the bed to at least 45 to 90 degrees, high Fowler's position, during meals and for at least 30 minutes afterward is the most critical intervention to prevent aspiration in clients with dysphagia. This position uses gravity to help food travel down the esophagus and reduces the risk of food or liquid entering the trachea. Thin liquids and straws increase aspiration risk, and rushing meals can lead to choking. The PN must ensure proper positioning and a calm, unhurried eating environment to enhance client safety. Question 38. A PN is reviewing a client's medication list and notes several medications that are highly metabolized by the liver. The client's liver function tests, LFTs, are elevated. What is the PN's most appropriate action? A. Administer the medications as prescribed, as LFTs are commonly elevated. B. Hold all liver metabolized medications and notify the physician. C. Administer half doses of the medications to reduce liver strain. D. Document the LFTs and continue to monitor the client. Answer B. Hold all liver metabolized medications and notify the physician. Elevated liver function tests, LFTs, combined with medications highly metabolized by the liver indicate a potential for increased drug levels and toxicity, as the liver's ability to process them is compromised. The most appropriate action is to hold these medications and immediately notify the physician to review the medication regimen. Administering as prescribed or reducing doses without an order could be unsafe, and merely documenting without action puts the client at risk. The PN must advocate for client safety by recognizing and acting on potential medication-related complications. Question 39. A PN is providing preoperative teaching to a client scheduled for abdominal surgery. What is the most important rationale for teaching deep breathing and coughing exercises? A. To prevent postoperative nausea and vomiting. B. To reduce anxiety before the surgery. C. To prevent postoperative atelectasis and pneumonia. D. To promote faster wound healing. Answer C. To prevent postoperative atelectasis and pneumonia. Deep breathing and coughing exercises are crucial preoperative teaching for clients undergoing abdominal surgery to prevent postoperative pulmonary complications such as atelectasis, collapse of lung tissue, and pneumonia. Anesthesia and incisional pain can lead to shallow breathing and decreased lung expansion, making these exercises vital for clearing secretions and maintaining lung capacity. While these exercises may have secondary benefits, their primary purpose is respiratory complication prevention, which is a major concern after surgery. The PN's teaching empowers the client to actively participate in their recovery. Question 40. A client with a history of alcohol use disorder is admitted for unrelated medical issues and develops tremors, agitation, and hallucinations 24 to 48 hours after admission. What is the most likely condition the PN should suspect? A. Hypoglycemia. B. Delirium tremens, DTs. C. Acute anxiety attack. D. Psychotic episode unrelated to alcohol. Answer B. Delirium tremens, DTs. The symptoms of tremors, agitation, and hallucinations appearing 24 to 48 hours after admission in a client with a history of alcohol use disorder are classic manifestations of delirium tremens, DTs, a severe form of alcohol withdrawal. This is a medical emergency that can be life-threatening. While other conditions might present with some similar symptoms, the timeline and specific symptom cluster strongly point to DTs. Recognizing these signs is critical for the PN to initiate prompt medical intervention to manage withdrawal symptoms and prevent complications such as seizures or cardiovascular collapse.